Okay, so I've created another assignment. This is going to be homework number 3A. We're going to do this before we move any further. I wanted to give you a little bit more practice in calculating treatment time, and I wanted to show you some variations according to what we really do in a clinical setting. We don't always use single fields like the previous assignment. Sometimes we use multiple ports. Sometimes we're using 2 fields, 3 fields, 4 fields, and I wanted to show you how to do manual calculations when we're using multiple ports. So we're going to stick with the same technique, SSD. And case number 1 shows a patient who's going to be treated using parallel opposed fields, APPA, and the dose is prescribed to the midplane, and we're going to be treating the patient's left lung using the SSD technique. The patient's total separation at isocenter is 3 centimeters, and the field size is 15 by 20. There are no blocks, and here's the prescription at 50/40 centigrade, delivered in 28 fractions, and we're going to need to calculate the treatment time. Okay, so now we can use the same chapters in the textbook to help us with multiple ports. That is chapter 23 in the principles book and chapter 10 in Con. And if you want to use the physics book, it's chapters 12 and 13. So I drew a diagram to get us started. So here's the patient in cross section, and here's the patient's total separation from anterior to posterior. The patient's total separation is 30 cm, and we're using 2 fields, AP and PA. This is the anterior aspect of the patient, of course. And we're going to prescribe dose. The dose is going to be given to the midplane. Now, the midplane means the midpoint of the separation. So the midpoint would be about right here, the middle of 30 cm. I'm going to leave that to you to figure out what depth that is. The middle of 30 cm. That's where we want to put the 50/40 centigrade. And we're going to divide the dose now into 2 fields. And since there's no information here about how we should divide the dose, what portion of the total dose should be given here and there is not stated in the question. So we're going to assume that each port is going to receive equal portions of this dose. This is called equal weighting. So I'm going to let you figure out what the prescription dose is going to be for each field. We're going to have to do 2 calculations. We're going to have to calculate the treatment time for the AP field, and we're going to have to calculate the treatment time for the PA field. So we need to figure out what dose needs to be given per fraction per field first. And then we're going to use all of our factors that you're familiar with already. Now the depth you're going to have to figure out, because we're using this midplane. They don't tell you specifically what that depth is. You can figure that out because we're going to go in the midpoint of 30 cm for both fields. Now case number 2 is similar. We're using 2 fields, again, parallel opposed lateral fields, and this time we're treating the patient's brain, and we're going to be treating to the midpoint of a tumor, not the midplane, but the midpoint of a tumor, which is located 3 centimeters to the left of midline. So I've made us a diagram here. The total separation from right to left is 16. The midpoint would be right in the middle of 16, which, you know what, is going to be 8 cm. The tumor center of the tumor is 3 centimeters to the left of midline. So I've just made some dots here to represent 1 centimeter. I'll put a dot here. I said that's the midplane of the tumor, and then I drew a round circle here to represent the tumor, which is 3 centimeters in diameter. So now the dose, the prescription dose, is going to actually go right there in the middle of the tumor. The tumor is not midline. The tumor is off to the left of midline. So again, you're going to have to figure out what the depths are for each field, and I'm sure that you're going to be able to do that by knowing what this information is, the total separation, and knowing where the midpoint of the tumor is and the total diameter of the tumor. The prescription is given 60 gray and 30 fractions, so we're going to have to figure out the dose to put for the right lateral. We're going to have to figure out treatment time for the right, and then there's going to be a different treatment time for the left. I need to know what the dose is. And again, since there's no specific information in this question about how to divide this dose between the two fields. We're going to assume that they're equal portions. They're equally weighted. And the other thing that's different about this case is that we have an absorber, no blocks, but there's a 15-degree wedge on both fields. And that wedge indeed has a transmission factor. Okay, so I'm going to let you work that out. You're going to have to figure out the depths, what the dose is for both. This is for homework 3A, and I've made it due this coming Sunday. I've also put a challenge in case number 2, for us to try and figure out dose to Dmax, and you can use chapter 23 in principles to help you with that. You can also use Khan, but try to get as far as you can with the challenge portion of case number 2. Okay, can't wait to see how you guys do with this one. Alrighty.